If you have any questions about cooking and food preparation, the Preventive Medicine Center does have a cooking DVD. It's called Putting It All Together, as is the name of this show, as is the name of everything I do. Putting It All Together. We're going to get a picture of that, or we're not going to get a picture of that? Okay, there it is. Putting It All Together. There I am in my white jacket, a little pasta sticking out, vegetables on the table, and this is the back side of it. Same thing. Now, going on, A1C management and modest weight loss in type 2 diabetes. This brings me to my discussion of generics. I believe in generics and use them when I can, but I honestly believe that there would be more money saved by not using generics in many cases. For instance, if a patient is diabetic and overweight, those are independent risk factors, diabetic, overweight. It turns out that Byetta will help that patient lose weight and at the same time improve their blood sugars. Byetta is probably a second or third tier medication. Turns out it's also an injection. And once you get past that idea, which is no big deal, it comes in a very easy to use format, then this will help you lose weight and not gain weight. There is another class of medication called Januvia. It's an oral form of these incretins, I-N-C-R-E-T-I-N. You might want to look that up, I-N-C-R-E-T-I-N. Same thing goes for the beta blockers. I have virtually no patients on atenolol. Atenolol is a twice-a-day medication. It's not a once-a-day medication. There would be arguments about everything I say, but that is my position, the position of the Preventive Medicine Center. Atenolol is the generic. I believe that Bystolic is a better medication because it has antioxidant properties and is working by the most important mechanism of nitric oxide release, which turns out to be an antioxidant and a vasodilator. It inhibits platelet aggregation. It inhibits the growth of the muscle cells in blood vessels. And again, I believe that there will be fewer office visits, fewer changes of medications, greater adherence, and reduced cost overall in terms of stroke and heart attack and sudden death by using certain medications such as the angiotensin receptor blockers as a group. But even there, my preference is for Benicar. The beta blockers, the two vasodilating beta blockers that are on the market, Coreg in its extended release form, and Bystolic, which has those have a better effect on insulin. The Bystolic has the antioxidant, as does the Coreg. And it has been shown that if you prescribe simvastatin versus Lipitor, there's greater adherence to the use of Lipitor as opposed to the use of simvastatin. So in the end, you're going to prevent more heart attacks and strokes by getting people to be more compliant. So I believe that we need to contact our HMOs and say, yes, there's a time and a place for this generic thing, but there really should be certain classes of medications, of which I've mentioned several, and certain medications per se, which are actually more beneficial. Plus the fact, if the dose of, let's say, Diovan, which is an angiotensin receptor blocker, or Benicar is prescribed, you can prescribe the highest dose and then use a pair of scissors to cut it in, yes, quarters or even halves to save money. Next, I want to talk about far infrared sauna therapy for cancer. That is something that I do believe in. Here's an article on it. And I even bought one a number of years ago, but I never really used it. There are far infrared saunas that are expensive that you can literally get inside of. The one I got was sort of a half circle like this, and you lay in it. Let's see. Curcumin. Curcumin is an antioxidant that has been shown to be helpful at raising good cholesterol and being a potent antioxidant. One of the studies that came out showed that there was less morbidity when people took antioxidants with their statin with their anti-cholesterol medication. And I do recommend the use of antioxidants on a initial 14 or 32 days full dose, and then reduce the dose and take it 4 or 5 days a week. A lot of people won't take medications, and so red yeast rice, which is available, and this medication, cholesterol, may be a partially acceptable alternative, but the best thing to do is do it naturally. The less you eat chicken, meat, cheese, eggs, milk, yogurt, skim milk, 1%, 2%, and even fish. And the more you eat foods like they grow in the field, such as brown rice, vegetables, beans, fruit, nuts, and seeds, the lower your cholesterol is going to be, the lower your blood pressure is going to be, because these are high potassium, high magnesium foods that have natural vasodilating, blood pressure lowering effect. And once again, you may say, well, I eat those. Well, you probably don't eat them enough, and you probably most people are eating animal protein twice a day. Tuna sandwich at lunch, piece of chicken at dinner. That's an entire week's amount of animal protein, and that is also lacking entirely in fiber, which this human body is designed to run on. I just remembered that I forgot to discuss my cufflinks last week. Okay, we need a close-up of this. These are my cufflinks. I had this, let's go back to it. It's okay. These are my cufflinks. They're Art Deco, French, and you can see them, little gold cufflinks with a cabochon ruby on it. And this is a regular shirt that I had made into French cuffs. It doesn't have the fold-over cuff, as you can see. And I had these made downtown at a tailor. So once again, if you want to know the name of that, please give me a call, and I will be glad to direct you. A very nice fellow by the name of Mo in downtown Hartford, and he charged very little, and so you get yourself a good pair of cufflinks, and I really like these a lot. I've had them for years and haven't worn them, but I finally had the shirts changed into French cuffs for about $2 to $3 a shirt, I believe it was. Here are some natural products for lowering cholesterol. This one is named Indian Gooseberry, and the product name is AMLA Max, AMLA Max. We have 1 minute. Curcumin, as I mentioned, can raise the good cholesterol. It may have a beneficial effect as an anti-inflammatory. 300 milligrams a day of curcumin is as good as, it says, phenylbutazone, and that's one of the better NSAIDs like Aleve, and it's entirely natural. Mitochondrial Energy Optimizer is a very good antioxidant. It's, however, very expensive, from Life Extension Foundation. Here literally is the article about the addition of antioxidants reducing complications. I don't think vitamin E is the whole story. That's why I like the Megafood brand antioxidant, which is a mixture. Got basal cell cancers? Here's an article that talks about the use of vitamin C and DMSO topical treatment to get rid of the basal cell cancer. And here is an article about getting better bugs into our bowel to prevent all kinds of disease. That one is about the probiotics, natural skin products. Well, I overdid it. Good day and God bless you all. I am Robert Silverstein, MD, for the Preventive Medicine Center. If you have questions, please call 549-3444.
There was a woman in Georgia, didn't feel just right. She had fever all day and chills at night. Now things got worse, yes, a serious bind. In times like this, it takes a man to style like getting out of a bind. A doctor of the heart and a doctor of the mind.